the clock should start. Let's see. Well, he maybe couldn't dial in until I had it started. Dr. Pearson, the top item on the agenda is to introduce and hopefully, and she's out sick today, so scratch that. Okay. We'll bump it to the next meeting.
It's occupational hazard. All right, is everyone here that we're expecting?
There's a gentleman that plans to join online, but
he was in the middle of his job, which he's a police officer, so I don't know what exactly he was doing, but I told him that I didn't know where he was in the schedule, but
okay, we can continue.
he's trying to get in here, so.
Okay, we can go ahead and start.
Okay, I will call this meeting to order. We have on our agenda first the approval of the minutes from our last meeting. I'll give everyone an opportunity to review those if you've not done that already. It was a pretty straightforward meeting, so I'll make a motion to approve.
Second.
Okay, all in favor?
Aye.
Opposed? Okay, the minutes of September 22nd have been approved. Next we have Health Department Division reports. Looks like Environmental's here to lead off, so.
No,
Okay.
something else.
All right. Then we will visually review these division reports.
But he could answer questions if they came up on the report. I mean, he could do that, but, yeah.
It's good that he's here to answer any questions we might have, so.
Mention of attended court for a housing complaint. Do we need to know anything about that?
Yeah, it was, we get that occasionally. It was a housing complaint and they actually signed off on it because the complaint wasn't what, how do I say that? When they went and checked it out, they didn't find the health hazards that was in the complaint. Does that make sense? So they signed off on it, and I'm guessing that somebody sued the tenant or whatever, and they called them on their behalf. So, yeah.
Just curious about the food pantries that are in the schools, and if we're seeing patients who are children, how they and their families could access those.
I'll talk about that with my report.
Oh, perfect.
I was hoping we'd get an update on that, so excellent. And maybe you'll address this too, but just curious about the level of vaccine hesitancy, especially in this school situation. It's better, worse, or the same?
There's, the nursing division staying very busy administering vaccines.
Okay.
Different school systems have different policies. In Sinawal, you just have to have your vaccines. They've taken a pretty hard line, appropriately. So they were getting a lot of children from the Sinawal school system. I'm not hearing that we're seeing a lot of problem with coming in.
Good to hear that. Okay.
We've offered after-hours clinics every Tuesday in October, and the schedule was booked for the entire, and everybody showed up. The Saturday morning clinics, they don't get great turnout for, but the Tuesday evening clinics have been booked full, and everybody has showed up for their vaccines, so.
That's very good to hear. Very good to hear.
It was at the Bridges to Health anniversary celebration, and they talked about their collaboration with the health department and the vaccine clinics and just how appreciative they were of that. So thank you for that. That's a great way to reach those people in our community. Make a motion to approve the division reports as presented.
I'll second.
Okay, all in favor?
Aye.
Opposed? Okay, the division reports are approved as submitted. Okay, health officer notes. Kira?
Well, it's good to be back. Last time we met, I was at boot camp, 24 hours. I thought I would have a great send-off and a great homecoming, and nobody even noticed. But it was good to be there. I'd gone 2 years ago, and I'd been in this position for like 2 weeks. So I had no context for anything that was talked about. So after being in this role for a couple of years, I was certainly able to have context, to absorb what was being discussed, and to ask more intelligent questions. Dr. Weaver was there, Dr. Lindsay Weaver, and we had some nice conversations just about the challenges in every county's facing, but to talk specifically about some Grant County issues. So I was grateful for that opportunity to go, and it was other health officers, so we were able to collaborate on what was happening in their counties and just learn from each other, which was a real positive experience. Our budget that we presented to you and you approved was approved by the county council. So we were grateful. We only asked for about 56% of this year's budget because of the significant cutbacks on Health First Indiana. And we were honestly very grateful that we got that amount. Because we know the county is facing a lot of unknowns with regard to what their cash flow will be with cutbacks due to Senate Bill number 1 and the implications of the county's income over the next couple of years. So we're grateful that we can continue to provide the local services with the staff that we have. But what will happen is we won't have the resources for all of those partnerships that we worked pretty hard to develop. So trying to think outside the box, how to collaborate when there's not money involved. Which, people need the financial resources, but because we knew HFI was being cut back early this year, we were able to give our partners a heads up as early as probably April, so that they would have time to start looking for their financial resources going into 26. So I was glad we were able to give that kind of notice. Next year at our annual report, we'll have updates on all of our partnerships and what was accomplished, but I wanted to talk about a couple. We recently got feedback from the Invitation to Health program through Taylor University. They just completed a 10-week intensive wellness program and had 75 participants that were involved in that. They had 800 contact hours one-on-one with people. The average weight loss in that group was greater than the 5% weight loss, which is what the CDC recommends for people to move towards better health. You know, we always think about that ideal body weight, but the first goal was lose 5% of your current weight, and that was achieved. They also noted that all enrollees lost some weight, even if not meeting the 5% goal. Their glycosylated hemoglobin, which is a marker of diabetes, dropped by 0.27 in the 10-week, and they had 4 members that moved from the pre-diabetic range to normal in that 10-week experiential. And so that was an example of how effective this kind of intensive accompaniment of patients can be to deal with these chronic health issues. You know, once every 6 month, 15-minute doctor appointment does not meet the needs, and that's why our healthcare system is broken, because that's what many people are offered. But this kind of intensive one-on-one coaching over long periods of time has made a real difference. So we were real excited to get that report from Invitation to Health.
I do have a question. Were the participants referred into this program? Or?
Yeah, they can self-refer,
Okay.
but as a physician in the community, we can refer our patient to Invitation to Health. And they actually had cards that said Invitation to Health. We would sign it as an order, and that would give the program knowledge that we were recommending it and that we felt that this person was able to participate.
Sure. Are there any future workshops?
It's ongoing. This program has been,
okay.
we were supporting and helping them go to the next level in their program. It's been in existence for over the last 5 years. They've had 6,400 patient contact hours, an average of 50 sessions per patient.
Wow.
Average weight loss in the long-term program, 17 pounds per patient, or 7.5% of their starting weight. They've had multiple patients who have lost more than 50 pounds, with one losing 125 pounds in 3 years in this program. A1C has dropped across the board, and they've been monitoring also what the patients are doing on their off days, and they've increased their steps and activity by about 20% just by participation in the program. So it looks like the program as a whole is doing really well and it's meeting goals that can't be met in our private practices.
That's good to hear.
The food pantries, the report said 4 schools. I only know of 3. Eastbrook School System, Mississinewa, and Marion all opted in. All the schools were invited, but then each school district had to decide if they wanted it or not, and if so, in what location. And they seemed to go towards the high school level. The schools preferred them in the upper grades versus the lower grades, just because of space in the buildings, I guess. Mississinewa is operational, and Eastbrook and Marion are almost ready to go. But there's, as you can imagine, many steps: getting the refrigeration, doing all the education, because it's meant to be a self-sustaining food pantry. So there's a lot of education with the school in how to keep their resources sufficient for their needs, and they can tailor it to their needs. So our investment with that was to help get it started with them being trained on how to sustain it. We've been involved in this prenatal food distribution program. It was a relationship between the Indiana Department of Health and I believe Gleaners through some grant that came to them. with the shutdown of SNAP benefits, we were informed 2 weeks ago that they were expanding it to families with a child under the age of 18 in their household. And so that was great. Their registration system did not limit the capacity to what resources we were assigned in Grant County. So we had been allotted 51 boxes with this program, and we had well over 300 families sign up. And this was a problem. And we learned about it like 2 days before this distribution was supposed to have happened on November the 6th. So Tara was dealing with the state. They owned that it was their oversight. They didn't think to cap it, although people were needing food. So anyway, it's going to happen Thursday. We've had to take it off site from the county because our little parking lot can't accommodate 300 cars. So what's the address it's going to?
It's at 8th and Adams
Okay.
down here. 819, 815, something like that, South Adams.
So the plan was this would remain in place until further notice, and likely when SNAP benefits came back, it would probably be done. So I don't know, this might be a once and done thing.
It's a one and done.
Okay.
The state has said one and done.
Okay.
That's it.
So that was interesting, but it's all turning out well. And the prenatal distribution never lapsed. The pregnant women were able to get their boxes on the 6th. And the state took at Tara's request, insistence, the state notified everybody of their mistake and said, don't come the 20th. But the pregnant women were still able to get their resources. So, yeah, I mean, we literally learned it was happening, and then we were told it's happening for 8 families with a child under 18, and then it was announced. It wasn't like we could opt in or out. So it was just.
How was this publicized that they got such an incredible response rate?
Everybody blasted it out because of SNAP. So it was like on social media.
Okay,
And
wow.
And shared and shared and shared
Yeah.
some more.
so, I mean, it was people were feeling desperate because it was going to be like
Sure.
the first few days into not getting benefits, and people were frightened. So,
I'm super happy that it happened and super amazed that for all our efforts at getting information out, all of a sudden, poof,
yeah,
it worked.
it worked. Yeah.
I think we need to take a deep dive into how that actually happened so we can replicate it. In some way other than making people terrified and desperate. Yeah, so.
I know people were, the schools have distribution systems, and somebody asked me for the pamphlet, and they distributed it to all the kids at Francis Slocum.
Okay.
So it went out to all the parents at Francis Slocum, in a second.
Yeah.
And so the uptake was really pretty powerful. And I think we're good. We were partnering, and we did not have any opportunity to prevent it, and had no way of knowing that their system didn't have a cap to what they had told us we could have. Live and learn, right?
Food scarcity is such an issue already in our community before the SNAP benefits, and knowing that our local food pantries have already been overridden and are struggling, so I can imagine.
Yeah, so it was not fun to deal with. But hopefully everybody will get what they need on Thursday. So I think that's all I have.
Thank you. Thank you very much. Okay, there's no old business on the agenda. I understand we were to meet our new communicable disease nurse, Sarah Cox. However, she is ill and will not be here. So next on the agenda is Nick Woodruff, who has an appeal of an abatement order. And has he been able to make it?
He's online.
Is he on? Okay.
Yeah.
Hi, Nick.
Hello.
Yeah, so tell us your story.
Okay, so it's kind of long, so I apologize in advance. I appreciate everybody moving repeated it. So about 2 years ago, we purchased our home in the Golf Edition at 6970 South Maple Drive. During our inspection, I have a VA home loan, so the requirements are pretty strict for anybody that's familiar with it. We had to do a inspection for the well. We had to do an inspection of the septic and everything. Roto-Rooter had come out. They passed it. There were some issues that were brought to our attention as far as the septic itself being outdated, but because there was no sewage leakage or anything, nothing that would contaminate the public waterways, nothing that caused a health hazard, and no proof of discharge, we're able to proceed with the VA home loan. I took a position in December of last year, about 3 hours south in Vigo County. Since then, we have put our house on the market. We had two buyers come in. One of them, long story short, they liked everything passed, but they wanted a new roof. We had a company come out and say the roof was fine. So we thought, because of our house is a nice house, that we would, just go ahead and pass on that one and see what else we could find. Fast forward to our most recent buyer. She utilized Brights to come in and do a septic inspection and was told that the septic was it needed replaced, or he would recommend it being replaced. I don't know. There's some disagreement. I had discovered, it's all hearsay at this point because there's no physical documentation, which is why nobody was sent anything. But in 2015 and 2018, Bright Septic inspected our residence, passed it. We had Roto-Rooter come in this year, or I'm sorry, when we purchased it, they passed it. Bright's come in this year, they failed it. Since then, we've been given an abatement order. My issue and my concerns and my request is that we have no septic problems. Our septic's running flawlessly. There's no odor of sewage. There's no sewage sitting in the yard. There's no discharge anywhere. There's no health hazard. So I'm trying to see why we're being given an abatement order off an assumption with no proof that there is a discharge.
Okay. Okay. So yeah, Jeff is going to speak to that.
All right, hi, Nick.
Hey, Jeff.
This is Jeff. All right, so as you know, Brights did that inspection, and they deemed that it was a tank to tile, which is an illegal discharging system. And that's per the code in the state rule that we work out of. And you also had Trexler's Solutions do an inspection, and they deemed it to be a tank to tile also. So with that being said, I have to act on that per the code. Because in order to be a system, you have to have a tank and a leaching field, whether it be subsurface or elevated. And there's no proof of that. The proof I have says on both of them that it is a tank to tile.
So my wife is also, she just keyed into, I'm not sure. So, and I understand, I guess, all that, what we have talked about previously. My concern is that all there's been no dye test. We paid the money for the soil samples, per the request of the health department. There's no contamination. There's no, there's not even any proof. Nobody can find a finger. So how are you saying that it's this system with no proof? Just because you guys did an inspection. Well, we can't find it. Well, if you can't find it, then how can you prove that it's what you're saying it is?
Would you be willing to let me do a dye test?
I've been requesting that since all this started. So yes, absolutely.
Okay, this is the first I've heard this, so we could set something up and I could do a dye test. We would have to go onto your property
Well, you guys have already
several
been there.
times.
I mean, that's fine.
Yeah,
My concern is in the meantime, can we get that abatement order lifted in writing until you guys have that burden of proof?
What do you think, David?
Certainly the dye test would be helpful, but in the materials, 410 Indiana Administrative Code 6-8.3-52, subsection D says any dwelling that is not connected or cannot be connected to a sanitary sewage system shall be provided with a residential on-site sewage system that includes, and this is the important language, a septic tank and a soil absorption system that has not failed. Jeff's position is there is no soil absorption system. And I think what Mr. Woodruff is saying is there is, it's just nobody can find it. That's one issue. The other issue, and Mr. Woodruff is correct on this issue, is there's no evidence of any failure. That's what the Indiana code, not the annotated code, but the Indiana code requires. There is no evidence of failure. So, since there's no evidence of failure, we don't have any complaints of sewage going anywhere. It's your guys' call. You can override that order, but legally, I would not have a problem with that order being temporarily overridden until we can find out exactly what the situation is by the dye testing, if that makes sense.
Okay. So if I could restate that, we would put a pause on the
Pause, yes.
a pause on the abatement pending the dye test.
Correct.
Yeah, I can understand their frustration if the system passed inspection multiple times prior.
I would not focus on the system passing multiple times because rules change over time.
Got it.
And we're going back to 16. I can't tell you what the Indiana Administrative Code said then.
Sure.
We have a ordinance now that has been in place for a couple of years that might not have been in place with these so I would not focus on that per se, but what I would focus
Understood,
on
yeah.
is that we don't have any evidence of failure yet.
Sure.
We have evidence that it might not be complying with the Indiana Administrative Code. We have evidence of that because we can't find a leach field, but maybe the dye testing will help shed some light on some of this.
Sure.
Is that fair, Jeff?
Yes.
Of your position, am I summarizing
Yeah.
that? And I agree with his position. I personally legally do not have an issue of if you want to, like you say, pause that abatement order for a little bit to get this done, assuming Mr. Woodruff is okay and cooperates with the dye testing. That I think needs to be a condition of the abatement order.
So can you
Pause.
explain a little bit about the abatement order and what limitations that puts on the residents, particularly if this residence is for sale and may transfer to another buyer? Like,
Okay, so basically when we issue an abatement order, which when we find tainted tiles like this, that's a common practice because of the code. Basically they're placed on a pump and haul order. So whenever the tank fills up, it'll have to be pumped, and that does get expensive. It's based on the water usage. So the more water you use, the quicker it's going to fill up, and then you have to pump it more. So basically, that order will follow that address until the system is installed, and we sign off on that.
And they would be required, since they've been told that the system is outdated or paint to tile, Now that they know that, they are required to disclose that if they were trying to, you know what I mean, like if somebody would come in as a buyer, they would have to say, hey, this is what we know about the septic system. And if they didn't do that, there could be repercussions, that would be out of our hands.
Aside from us, yeah.
So I do have a question for Mr. Glickfield regarding the ordinance. You said it was in place 3 years ago or something along those lines?
I don't know exactly when it got put in place. I'm guessing it's been 2 or 3 years ago.
2024.
April of '24.
April of '24, they're telling me, so not even 2 years ago.
So would that
Two
include
years.
any retroactive, like any type of
What I'm
retroactive
reading-
or
What
retroactive?
I'm reading is, I'm going off the Indiana Administrative Code, not the local ordinance. I'm saying an inspector, when they inspected it, might not have been aware of the ordinance. And in fact, depending on when they inspected it, anytime before April of 2024, that wouldn't have even been in place. But the Indiana Administrative Code, I don't know that for a fact because I haven't researched it, but I'm pretty sure that definition has been there for a bit.
So I guess, and I think I've probably beaten this like a dead horse with Jeff, and I apologize. I guess I just want to keep on, make sure everybody hears my side. So with the changes in the codes over the years, at the time the system was in place, it was at that time it was legal. Obviously, things change over time. My question is, if it's not failing and it's not creating any type of pollution or anything, and we confirm that with a dye test, is this something where until a pollution occurs to a waterway or some type of health issue that we are required to place the new septic in? Since it was, at the time it was placed in, it was at code, now it's not. Does that make sense? I'm not sure if it makes sense.
So, yes, no, I understand what you're saying. That's why I said you have 2 tracks going on here. You have the first track, which is the health hazard polluting waterway. That comes from the Indiana statutes. But you also, secondly, have a requirement through the Indiana Administrative Code that you have to have a residential on-site sewage system that includes a septic tank and a soil absorption system that has not failed. There's no evidence right now that you have a soil absorption system on your property. You may have one and it just hasn't been found, but there's certainly no evidence that you do. The suggestion has been, whether it's proper or improper, that you have a field tile that's going who knows where and discharging effluent who knows where. That's why the dye test would be helpful to find out if that's happening or not. So my suggestion was do the dye test, you cooperate, see if they can locate if that's going anywhere. And in the meantime, put a pause on your pump because there is no evidence that you have any health hazard dumping into a waterway, and see when that dye test comes and then revisit the issue.
And I am completely okay with that. I mean, at this point, we're even okay with allowing potential buyers. I know that's not your guys' concern, but like we're okay with just taking a hit on and just breaking even at this point to give buyers the opportunity to put in a new septic. Our biggest thing is, like, we haven't been able to sell the last 3 buyers because of this abatement order, and we should have already been, my family should have been here in Terre Haute, and that is a huge concern to me. And I know it's not of any fault from Jeff, but I just feel like maybe it was moved a little too quick without evidence. And that's my concern right now, is moving forward. I would like to, if I could, get some type of official correspondence from Grant County advising that this property is, temporarily on no abatement order, or even that no abatement order is in place at the time.
I feel the need to point out that we do have 2 inspection reports saying that it's tank to tile. So to say no evidence is not fair.
Right.
No evidence of contamination. I'm sorry, I should have been more clear.
How long would it take to do a dye test and have, a day, a couple days?
Couple weeks sometimes.
We would have to do it, we'd like to do them on Monday, Tuesday, or Wednesday. That way we've got a couple days we can go out and look before the weekend, since we're off on the weekends. and it's supposed to rain tomorrow, so I don't know that that's a good idea. So the quickest I could do it is Wednesday. I would have to set something up with the Woodruffs to get in there to do it.
Now, is this at any expense to my wife and I, or is this at the expense of the county? Because
No.
we can't afford anything extra at this point.
No.
We just spent all that money on the soil samples, and I feel like that was kind of premature as well.
No, there wouldn't be any cost to you. We'll just, we've got the dye, we'll just introduce it into the toilets, the sinks, and then flush it out real good. You haven't had the tank pumped recently, have you?
No, but I'm going to be honest, because I was in protest of this abatement order, and we have no sewage overflowing. So no, I definitely have not pumped it.
Okay, so if it's been pumped recently, that'll negate the fact, because it won't discharge out. But I can set something up. Somebody give me a call tomorrow, and we'll get something set up for Wednesday, like morning. And then I'll go walk the creek and see if I see it. And then we'll have to get on there a couple days to do that, if that's all right.
Yeah, I mean, you guys can do whatever you have to do. I guess my biggest thing is just protecting our property and our interests as well. But I guess like kind of just future thoughts, and it's probably not gonna be my problem if our house sells and we move to Vigo, but are there any protections in place or anything for current homeowners or potential buyers in the future? Because we kind of feel like it's unfair if you got, the rules are updated and force people out of their houses, because at the time that houses were purchased, everything was fine. And now a new rule comes out and now it's not okay. Well,
I'll tell you, I've been here 8 years, and this rule has been here before my time here. So we've enforced it like this. When we get a inspection report, let alone 2 of them that say that it's a tank to tile, that's our standard practice, is to send an abatement order.
So, and just so I'm clear, I'm sorry, I apologize. One more question I have is, with the abatement order said that there's proof of contamination, but there's no proof.
Well, like Mr. Glickfield said, let me find it here.
Just reword it to fit 410 IAC 68352D. Just reword the abatement order, fix that. It's very easy. Basically, there's no evidence that there's an on-site sewage disposal system.
Okay.
Don't say there's a health hazard,
Okay.
okay? There might be, we don't know yet.
Yeah. All right. What'd you say that code was?
52D.
52D.
Mm-hmm.
Yeah,
All right.
IAC 6-8.3-52D. You got it in the packet that I have. You provided it higher tear.
Oh, yeah.
Did.
Okay.
How accurate is the dye test?
Well, it goes in like red. As soon as it hits water, it turns like a vibrant, bright greenish yellow. If it's going to show up, we'll find it. So, yeah.
Yeah, you can't miss it. When it pops up, it pops up.
So when Trexler's came out, the picture that Bryce had taken of what he assumed was where it was allegedly discharging from, he said it had been bone dry for a very long time. There was absolutely no moisture in it whatsoever. So I'm not sure where it would be going. So that much we know is at the very least that part is incorrect of it. I don't know much else about the rest, but we do know it wasn't coming out of that specific one.
Okay.
Yeah, I think Trexler's actually cambered that line.
Yeah, he
He
did.
said, I don't know where it's going, but it ain't going to their septic
Yeah.
system, so.
Yeah, that's what his report says. So, so we'll do the dye test, and somebody get with me tomorrow, and we'll set that up. And we'll go out and do that dye test, and we'll see if we can find it.
Can we get a letter emailed to us as soon as possible so we can provide that to our realtor to push out to these potential buyers that were turned off by this? saying that there is no abatement order, so they're not responsible for $400 a week on top of a mortgage.
You, assuming the board's okay with this, I am fine with you saying that the pump and haul order that was put in place has been temporarily stalled based on further examination, something like that.
Okay.
And it's not based, you can also say it's based on the Indiana Administrative Code, not the discharge in the waterway.
Okay.
I'm fine with this, you putting that in the form of a letter. Email it to me and I'll prove it, make sure it's okay,
Okay.
before you send it.
So the abatement order still is in place.
It's just
but
being
the pump and
stalled.
haul is
The
suspended.
pump, correct, the pump and haul is being, that's exactly right.
Has been paused, yeah. Okay, all right.
So if we can't find the dye, what is the next step to, how do we find out what we have going on without digging up everything in the yard?
Well, Trexler did a camera, but he didn't go all the way. He told me he stopped down at the bottom of the hill. That little insight, the backyard, there is a very steep hill with steps going down it. He stopped it down at the bottom. So I don't know if we get somebody to camera farther to see if they can see where it's going.
Is that off the property?
At that point, it's getting
No,
pretty
it is
close.
not. Ours goes clear back to the creek. So what it does is it takes an odd turn, and that runs out, and it does quite literally a 90-degree drop, like straight down. Because that much we could see. He was great. He walked me through all the steps, all the things. But no, our property line is quite a bit further back. We just, like I said, couldn't. And then he did take our hose, and he was here for 3.5, almost 4 hours, doing his best to figure out what we've got going on. And I mean, he did his due diligence, I can say that.
I believe he told me that it takes a sharp left down at the bottom of the hill. So your property is not very wide. So I don't know which way it goes from there. Your property does go back farther. So we're gonna try to do the dye test and see if we can figure this out.
Just leave it at that.
Yeah,
So,
okay. So I would entertain a motion, gosh, how do we want to state this? That the board table any action on this abatement until the dye test has been completed and we have more evidence. And that the letter be prepared as recommended. I guess that covers it, right?
Yes, I would state that, for the record, Tara could put this in the minutes, that Mr. Woodruff, well, the Woodruffs have appealed the abatement and pump and haul order. And the abatement, because it does not meet Indiana code, Indiana Administrative Code, is currently staying in place pending further investigation. However, the pump and haul is being stalled because there's no evidence of any discharge into waterways, no evidence of any health hazard, and that the Woodruffs are going to cooperate with the health department to allow them dye testing to see if they can get to the bottom of it. And because of that, this is tabled, his appeal is tabled till the next meeting to see what further evidence comes out.
Okay,
That,
got all that?
Well, it's recorded, so I quit.
Yeah, that's good, okay.
that's basically the extent of what the record should show and what the motion should be.
Okay, very good.
If dye is found, do we reinitiate the pump and haul order
Let's cross that bridge when we get to it.
Yeah,
without the board input?
No, he can, if it's found, he can put it back in place himself.
Okay.
And then the appeal can be finished.
And I apologize. If there is a contamination found with the dye test, will we have a reasonable amount of time before being capped in order to do the pump and haul? Because so I'm sorry. If there's a contamination, the earliest we could even, if we kept the property, to get a new septic installed would be spring of next year. That's a lot of money per month that we couldn't save to put in towards a new septic. And without actual issues flooding the house, like, would we have any type of leniency on that?
My suggestion would be, let's address that at the next meeting. See what's found.
Otherwise, it's pure speculation.
Exactly. And I would prefer you guys not make decisions based on speculation.
No. Okay. All right,
Motion, do I have a second?
we need a second for the motion.
I'll second it.
Okay, all in favor? Opposed? Okay, the motion holds that we will postpone a decision on the abatement until we have more information and prepare a letter for the Woodruff family. And it will be so recorded in the notes as our attorney has recommended.
Would we be able to receive it by in the business day tomorrow by chance?
Can you repeat that?
Would we be able to receive that letter by end of business day tomorrow by chance?
Yeah, I'll get it composed tomorrow and I'll send it to Mr. Glickfield, and then as soon as I get it back, I will send it out to you. I can
Perfect.
even
Thank
email you a copy.
Yeah, that would be fantastic. Thank you all for your time. I appreciate your assistance with this.
Okay, very good. Okay.
Okay, you're done.
Thank you, Jeff, very much. Appreciate it. All righty. Next in new business, our proposed meeting schedule. I think we discussed this last meeting, or did we? Maybe I hallucinated a different board meeting. Okay.
We were just sticking with the fourth Monday, except on holidays, like Thanksgiving was, you can decide, but then there's Memorial Day that also we moved a week earlier because.
Okay. So when we have Monday, holidays, okay. So that is how this schedule has been set up, without a calendar in front of me.
Yes, they're all Mondays.
Okay, all right.
So you would need to decide on November, do you want Thanksgiving week, or do you want the third? I mean, one's right before Thanksgiving, one's right after.
Does anyone have a strong opinion either way?
For the 30th, we just always have company on the 23rd. It's not a strong opinion, but that's my preference.
I'm good with either one.
I know.
Don't bother me a bit.
Okay. 30th, good with everybody? Then let's pick the 30th. Okay. I would entertain a motion to approve the schedule as proposed.
Motion.
Okay,
Second?
all right, all in favor? Aye. Opposed? Okay, that is our schedule for 26.
Well,
We open the floor for any public comments. There's one public with no comments. I would entertain a motion to adjourn.
Second.
All in favor?
Aye.
We are done. Okay.